My name is Cedric Freeman. The exercise we're looking at today is the overhead squat. And the impairment is for the knees to move outward, or knee varus, which is abduction and externally rotation of the tibia femoral joint. It matters because this imbalances places the knee and its ligament in a compromised position and at risk for potential injuries, especially for power lifters. Here we have my subject, which is my wife, Marissa. All right, she's gonna have her feet hip width apart with her toes pointed forward. Her knees are over her second and third toes. Her arms are extended straight, parallel to her ears. Hands are facing inward towards each other. As she begins the eccentric motion of the overhead squat, the knees move outward, which could be an indication of some muscles being over or underactive. Potential overactive muscles during this eccentric motion of the overhead squat is the bicep femoris, which is causing the tibial to externally rotate. A potential underactive muscle during this eccentric motion of the overhead squat is the glute maximus. It should provide tibial internal rotation. Since we identified some potential overactive and underactive muscle, we're now going to focus on how to inhibit and lengthen that overactive muscle and activate and integrate that underactive muscle. These 4 phases are known as the corrective exercise continuum. To inhibit the bicep femoris, we would use the self-myofascial release technique to decrease overactivity of neurons, myofascial tissues. The SMR technique that we would use is the foam roller. We would hold this on the tender spot of the bicep femoris for 30 to 90 seconds. We will roll back and forth on the tender spot for 30 to 90 seconds. Do this 1 time daily. Next, we will focus on lengthening the bicep femoris to increase range of motion at the tissue and joint. To lengthen, we will use the static stretching, which allows for relaxation and concomitant elongation of the bicep femoris. So this bicep femoris static stretch should be done daily, 1 to 4 reps for 20 to 30 seconds. Next, we will focus on activating the underactive gluteus maximus muscle. For this activation, we will use the positional isometric technique. To do this, I will have the client lie in a prone position with the assessed glute leg at 90 degrees. I would then have one hand at the small of her back and the other hand on her bicep femoris. The hand that's on the bicep femoris will be the one to apply pressure or resistance downward. And I will apply that resistance downward 4 times, or for 4 seconds, sorry. And we would do this 4 times, increasing intensity from 25% up to 100%. We will have a 2-second break in between each contraction. So it would look like this. Ready? Go. 1, 2, 3, 4. Relax. 1, 2, 3, 4. Lastly, we will focus on integrating the gluteus maximus muscle by using a integrated dynamic movement. We will start with ball squats, doing 10 to 15 reps. To progress from the ball squats, we will move up to step-ups. We will repeat with 10 to 15 reps of step-ups. 1 set. To progress from step-ups, we will go to lunges, focus solely on the gluteus maximus muscle that is underactive. Last integrated dynamic movement we will focus on is the single leg squat for the underactive gluteus maximus muscle. So it's my right leg, 10 to 15 reps.